Okay, good morning, everyone. Um, you can actually respond in the chat box if you can hear me loud and clear. I'm hoping that I'm very audible and very visible as well. To sort of celebrate the fact that I'm happy about this session today, because I know this is one of the top topics that the community of practice members chose that we have a session on earlier in the year. So how does knowledge management and adaptive management fit together? Most times when we've heard about adaptive management, we've heard about it mostly in theory. So we've sort of brought two great speakers to talk to us about adaptive management, how they have used it in the past, and probably share experiences with us. And of course, we would have opportunities for questions and answer. So I have the very singular honor of introducing our speakers to you today. Our first speaker would be Piers Bocock. Is a co-founder and principal at Acute Insights. Piers is a recognized international development leader and innovator with a focus on developing and implementing effective adaptive management, organizational learning, organizational development, and stakeholder engagement approaches that deliver sustainable results. So Piers' repository work includes working with some of the world's largest organizations like USAID, UNICEF, DFID, GIZ, and a host of others to improve their knowledge management and organizational learning capacity. He has also worked on the front lines with communities in some of the planet's poorest countries. So Piers would be talking to us about some of the examples that he has, how he has worked in the past with these organizations. And the next speaker would give us practical examples on how he has operationalized adaptive management within his organization. And that's Lekan Ajilola is the TCI Deputy Director of Technical Operations in Nigeria. So Lekan is a doctor, is a public health physician and development specialist with 13 years of experience in the management, coordination, and implementation of different public health projects in diverse communities in Nigeria. He has experience working on projects funded by Center for Disease Control, the United States Agency for International Development, of course, USAID, Global Fund, Bill and Melinda Gates, Bayer, Comic Relief, and other private donors. So he has robust experience in stakeholder management, policy administration, advocacy, program planning and design, strategy development, implementation, and of course, monitoring and evaluation. So we're in good hands today. Piers has about 30 years experience in this space as well. So I'm really excited about this session. So how are we going to run today? We're going to try and look at what adaptive management is, what does good adaptive management look like, and what does knowledge management have to do with it? So that will take about 35% of our time. And then we'll also look at adaptive management in action, as I've mentioned, from the TCI Nigeria's experience with Pause and Reflect as a key case study. So Lekan will be taking us through that. And then we would obviously have a general reflection and discussion around that. And once we have questions from the get-go, when the speaker starts speaking, we would encourage all of us to put our questions in the chat box so that we can take them on a first come, first serve basis immediately after the speakers have done their bit. Unfortunately, Piers had some slight logistic issue, which probably kept him in the air for a bit. Is stuck in IT, but is going to get back to base soon. But we didn't want to push this back and move this session because we know a lot of people have been looking forward to this. But he did have a recording for us, and I would hand over to Lisa to please play Pierce's recording, which is around this, and then we'll take, and Lekon will take over from him as well. Thank you very much. Looking forward to an exciting session. Over to you, Lisa.
Could you hear it? He started. Here.
Okay, so we can't hear, but
okay.
I think
then I know what I need to do. It's my
exactly.
So hold on 1 minute. Okay. Share sound, optimize for video clip.
Thanks for the introductions, and I am
Can you hear
sincerely
now?
sorry I am not here with you live today. But I
Great,
am
thank
in
you.
Haiti trying to get back home after an intense assignment, and the travel plans have conflicted with this presentation. But I hope that this recording will at least help share some ideas with you. So let me just start with this. What is adaptive management? Well, adaptive management is, or has become, a bit of a trendy term these days, which acknowledges something that good project managers have known since the beginning of time. Very few projects go according to plan, and one must both plan for anticipated changes in context while also having a team that is agile enough to do so. Adaptive management is a term that has become an officially adopted approach by USAID and has even written it into its guidance to missions and operating units. And USAID defines adaptive management as an intentional approach to making decisions and adjustments in response to new information and changes in context. So, in more traditional project and activity design and implementation, a proposal and/or an initial work plan might look something like this. The graphic is, of course, overly simplified, but the point is valid. More often than not, at the outset of a project, we are asked to do some in-depth thinking to get clear about the context and the goal, understand a causal chain, identify and establish interventions, set targets and indicators, and then monitor and report on them on an annual basis. But what if something changes that has a significant impact on our ability to deliver as proposed? Just think of COVID as one example of an unanticipated change in context. Now, if we look at a simplified version of what you might consider to be an adaptive approach, you'll see that there's an explicit acknowledgement for the need for frequent feedback loops and opportunities to confirm that our assumptions, interventions, and context still support our theory of change and work plan. And if they don't, that there are explicit opportunities built in to provide such opportunities. In our work, we're seeing more and more organizations and activities, including at least annual and sometimes semi-annual or even quarterly pause and reflect moments into their monitoring, evaluation, and learning cycles. I have included this slide here to emphasize again, in an overly simplified way, the concept of adaptive management. So let's use the example of using Google Maps to get from USAID and their building at 1300 Pennsylvania Avenue in Washington, D.C. to Success Avenue somewhere in California. Depending on various criteria that may matter to me, I might want the fastest route, the most scenic route, or a route that ensures a stopover in a particular location. The destination may be the same, but how I get there may change based on different criteria. And presumably, if you're anything like me, you review your route and traffic patterns on an ongoing basis. I know this is a simplistic analogy, but it does help some people. And while I know I may be preaching to the choir with this group, let me just make a few points about why adaptive management is important. First, we know we have to be accountable to our funders who are expecting meaningful results in the short term and lasting impact in the long term. By validating assumptions, contextual factors, and what we're learning along the way, we're able to be more accountable and more capable of answering the why questions. Second, our world and our projects are usually immensely complex, dependent on any number of factors. We've finally recognized that there are no cookie-cutter approaches, and we have to take local contextual factors on an ongoing basis into account. And third, as we've all witnessed over the past couple of years, and many of you have experienced frequently throughout your careers, we have to be prepared for unpredictable events that impact our ability to do work as planned. So, most of you, if not all, already know that USAID tries to explain various components of its vision for adaptive management throughout the program cycle in its Collaborating, Learning, and Adapting, or CLA, framework, depicted in this small, colorful wheel towards the bottom of this slide. What you see here on the bulk of the slide is the so-called maturity scale of adaptive management in USAID's eyes, from not yet present to institutionalized. For example, USAID considers a team, a mission, or an operating unit or a project advanced if they, for example, usually work with key internal and external stakeholders to analyze successes, challenges, and failures to identify lessons learned and areas for further exploration. Or if they usually use ongoing learning to consider whether to maintain, adapt, or discontinue existing approaches, or usually work with other colleagues to adapt as needed. And it's important to note that pause and reflect methodology is a frequent and now well-accepted methodology through which to do these things. So what does all of this have to do with good knowledge management? First, I should say that both Stacy Young, one of the godparents of the CLA approach, started her career in KM, as did I, which helped me when I was the chief of party for the USAID Learn contract, which helped create this framework. But let's also look at how USAID categorizes an advanced team from a KM perspective. The elements they suggest effective KM teams are usually doing include sourcing relevant technical, contextual, and experiential data, information, and knowledge from key stakeholders. How do we do that? Good KM. Here's another: distilling key data, information, and knowledge to inform decision making. How do we do that? Again, good KM. And then there's also sharing knowledge strategically and in user-friendly formats for various audiences, something that CCP has always emphasized. So if anyone ever asks you what KM has to do with adaptive management, here's your answer. This slide is simply an attempt to show how adaptive management, or CLA, approaches are practical methods for supporting a variety of project goals, often also associated with knowledge management. So, for example, when doing stakeholder engaged design, adaptive approaches often include statements of objectives over set targets, and they leverage theories of change, scenario planning, and learning agendas. In adaptive work planning, we like to see multi-stakeholder engagement, short cycle work plans, quarterly pause and reflect sessions, and iterative monitoring, evaluation, and learning. For implementation, you might see more piloting of efforts and short cycle testing. Ideally, we'll see an emphasis on progress over perfection and the use of after-action reviews and before-action reviews, which are derived from and help inform ongoing knowledge management. And for adaptive monitoring, evaluation, and learning, we like to see external factors included, such as context monitoring, clear results frameworks, and even opportunities to officially learn from and adapt as a result of failure. This is an example of a pause and reflect methodology that we have used at Acute Insight in support of a USAID Save the Children project. And it's fairly structured, but the highlights here I want to point out are that we actually consider a number of different factors. In terms of inputs ahead of time, we like to make sure that individual staff input and reflections are considered in response to prompting questions. We like to consider inputs from team-based quarterly pause and reflect sessions that can feed up into the overall quarterly pause and reflect. And we like to actually look at quarterly context monitoring data, stakeholder survey inputs, and ongoing M&E data. Then we actually have the pause and reflect discussions, often talking about elements including effectiveness and alignment with our funders and our partners. We also like to look at how we're doing against our work plan activities, what's working, what's not, and perhaps why. But then after the actual pause and reflect event, there's some synthesis pieces that need to happen. So we try to identify solutions to ideas or challenges. We document proposed work plan activity adaptations, and then we actually identify topics for further discussion with USAID, and that's the Bureau for Humanitarian Assistance, and our advisory committee. And then finally, we actually pull some of those syntheses out for other project consortium meetings and reflection. So they lead to regular and specific outputs that can be then used as we move forward. This slide here is one I just always like to share because it was our first attempt on the Learn contract to depict what we mean by a continuous learning, monitoring, evaluation, and learning cycle based on monthly reflections and data, quarterly pause and reflects, and semi-annual work planning. And it really helped not only our team understand why particular information was being asked for and when, but was able to get our USAID team in alignment with us on this approach. So I think that's enough out of me, but I did just want to end by reinforcing some principles to help ensure that adaptive approaches have the chance to become part of a project or a team's DNA. We like to talk about these approaches as being intentional, systematic, and resourced. By intentional, we mean that they are integrated into existing processes and that they are integrated with existing knowledge management systems. Systematic, we mean actually setting out and having them planned, scheduled, valued, and stuck to, and embedding them within the existing monitoring, reporting, and planning cycles. And resourced, we mean making sure that funds and people are prioritized, funded, and modeled by leadership, and that there's time and space and support for continuous collaborating, learning, and adapting. So, thank you for your time, and I'm really sorry I'm not there in person to answer questions, but I would be happy to receive questions to which I can respond later. Thanks again.
I hope you all enjoyed that presentation from Pierce. As he promised, he is available to answer any questions. So please feel free to put them in the chat specifically related to his presentation, and Balade and I would be happy to follow up with him. Now we'd like to turn it over to Lekan to share with us a specific example of how CCP has operationalized adaptive management within the TCI Nigeria project. Over to you, Lekan.
All right, thank you, Lisa. Hello, everyone. I think Pierce has made my work easy by first introducing adaptive management and also sharing a bit around the pause and reflect approach. I'll try to really dwell on the practical experience that we've seen in the Nigeria program. Okay, so this is to show us a bit about how we have evolved in the TCI program that is implemented by CCP in Nigeria. In the beginning or the early implementation phase of the program, about 2017 into early 2018. Adaptive management approaches was really unstructured for us. Staff members implemented it passively, in meetings and during other venues that they have opportunities to do some element of responsive feedback. We didn't really have any systematic way of monitoring adaptive management approaches at the time. But with transition into the scale-up period, that's around the mid-implementation phase, 2019, 2020, we began to really have structures for our adaptive management approaches. We introduced the pause and reflect exercises. We also had the reflection and action to improve self-reliance and effectiveness, which we popularly call the RAISE assessment that focuses on assessing government towards self-reliance. We also have the most significant change stories that we're using. All of these were done on a quarterly basis, so it was more structured and into our existing systems. Of course, we're planning actively for AM approaches as well as also monitoring to ensure that staff go through with the implementation of these approaches. We also identified systems for follow-up and ensure that we're monitoring the implementation of the recommendations and the actions that have been taken during those adaptive management approaches. Currently, which I can say that we really have a strong and systematic approach for adaptive management interventions in Nigeria. Pause and Reflect has even gone beyond the country office where we have it quarterly, but now also holding at the state level. That's across the local governments that we support in Nigeria. It's also holding quarterly. And of course, by virtue of the fact that we are now holding it at the state government level, the participants now include government staff who are really the target of the exercises. We're also disseminating the lessons that we're learning from the Pause and Reflect exercises through webinars, publication, and other medium that enables the wider stakeholders to be able to use the actions to improve their programs. Next slide, please. Okay, so pause, reflect, and act, we said, and that's what we call it. I think the first thing I'd like to focus on here is why for us we're using pause and reflect. And the first thing is the fact that we're funded by a donor that supports fail fast approach. I mean, they allow us to really be innovative around moving very fast, failing fast, and also re-strategizing and also implementing the changes that we have agreed on during the reflection exercises. Our TCI project in Nigeria is also a fast-paced project. We're allowed to scale up very fast. And we know that most programs still have issues around scaling up approaches when working with state government, especially when state government are the ones leading the interventions. And for us, we don't have enough time to wait to the end of the program before we make changes and see the desired improvement. So we needed to be able to support government to identify what works for them, what they can easily run with, and what they can sustain. So that really allowed us to use the pause and reflect sessions to be able to help them improve how they do their work, as well as how we can streamline and right-size interventions that they need to implement in the states. We know that change is constant, and for us, what we're doing is that we're supporting governments, and also we as an organization that is into health and development programs, we're improving our approaches through adaptive management and through continuous learning. ACT is very important, and that's why we've colored it in red, to let us know that as much as we conduct pause and reflect exercises, it's not complete until we've ensured that the recommendations and actions from those exercises are really implemented to ensure that improvement, or to be able to see the needed improvement that we are desiring for. Next slide. All right, so this is what the process looks like for us. The first thing that we do is that we identify a particular topic or an area for reflection. So depending on what is happening at a point in time, we want to choose a topic that we want to reflect on. And once we've chosen a topic, the next thing is that we select and notify the participants that are relevant for that topic. So you may choose a topic where a particular set of participants will be relevant for, and they may not be relevant for another topic. So that changes sometimes with the topics that have been selected. And then we move ahead to conduct the pause and reflect exercise proper. Of course, very importantly, we report that exercise and then ensure that we implement the approved actions or the recommendations that came out of that exercise. Like I said again, we always ensure that we try to monitor the outcomes of those implemented actions so that we're able to see the milestones or see that improvement that is coming from it. And if there's no improvement, we're able to track that and also see how to even further course correct. Yeah, so this is the P&R. I mean, this slide shows us the participants that are involved in the pause and reflect exercises. We have the technical leads at the country office in Abuja, technical leads at the state level as well. Be it advocacy team members, service delivery team members, demand generation team members. Based on the topic that have been chosen, we select the technical leads that will be involved. Program management team, the research monitoring and evaluation team, very important. The state program coordinators at the state level. And like I said, the counterparts in government as well, whether it's demand generation or it's service delivery or it's even research monitoring and evaluation, they are also part of these exercises, and any other relevant staff that should be part of it are usually involved in the exercise. This shows us the continuum of the pause and reflect exercise proper. The first thing that we do, is to reflect on what works and why it works, or what doesn't work and why it's not working. So a lot of times we don't just get those insights from the team, but the team is able to also brainstorm and tell us that, okay, this is the evidence for what is working, and this are also the evidences for what they are saying not to work. So we document those evidences and the findings, as well as the reasons why we're getting results from the approach, or the reasons why the approach is not working. That is documented. We move on to also articulate key recommendations and proposed actions. So the team brainstorm, they talk about what they believe are innovative ways of solving the problems or removing the obstacles in order for us to be able to achieve improvement. Of course, those action plans are assigned to particular responsible persons and within a particular timeline for them to ensure that those actions are implemented. Since we do it quarterly, most of the time the action plans are within the quarter, but for some actions, we know that it may be beyond the quarter and it's taken forward. We disseminate the P&R report to the larger team because everybody cannot be part of the exercise. And then the larger team also contributes to reading the report, to seeing what was deliberated on, and also the actions, and supporting the implementation of those actions for adoption. And then we monitor and track implementation of those actions for the improvements that we desire. Okay, so this is to share a bit of, say, synopsis of the pause and reflect exercises that were conducted in Nigeria. I think I'll just be showing us two examples. So the first one, the first topic that we had was around scale up and sustainability, because these are really two major tenets of the TCI program. And when we had this discussion, there were a lot of insights from the team that deliberated during this time and reflected during this time. The first thing was that we saw that the TCI lead, assist, and observe coaching approach is effective. It's effective for us to be able to build the capacity of the local government team for them to scale up and ultimately achieve self-reliance in FP programming. The lead, assist, and observe coaching coincide with three phases of TCI. TCI has the startup phase, where TCI team sort of lead and government sort of learn and follow TCI to implement. The scale-up phase is the next, where TCI really assists and the government is in the lead and TCI just assists from behind. And the observe phase is the pre-graduation. Observe coaching model coincides with the pre-graduation period, where the government is very close to graduation and they are really fully leading, and TCI is providing only on-demand technical assistance. So we saw that that model really worked, and that was the insight from the team. And then the action that we took was that we needed to intensify this approach. We needed to take it even further within the current geographies where we're working and expand into further or other geographies so that they can also use it. And then these actions were implemented, and part of the improvements that we recorded was that we saw that government team were now adopting the approach for coaching not just in family planning, but also in other programs beyond family planning. Another example is identification of the family planning enriches as an effective strategy to ensure that we increase access to FP services. And like I said, we always focus on the evidence for some of these insights that we get from the team. The enriches is just like outreaches. The difference is that in enriches, you mobilize in the community, but you mobilize to a nearby facility so that there's complete referrals, and then the women are able to take up methods in those facilities. We saw that that was really working. We're really getting the numbers from that approach. And as such, we implemented exchange learning visits for new states and also existing states that were struggling with access to implement the approach. And now all of our states really are implementing enriches as their number one high impact intervention that is contributing to improving access for services. And we're seeing that they are even sort of including enriches in their annual operational plans and their costed implementation plans, so that they could really sustain it and they could get funding for it even beyond the period of TCI. This, I think we should move to the next slide so that I don't go beyond my time. These are other examples. We're going to share the slide so that you can see some other examples. So we also reflected on TCI coaching model. For the coaching model, we also got some insights because coaching is really big on one of the approach that TCI is scaling up across the geographies where we work. We saw that when states have periodical coaching schedule or they have a plan that says, oh, this is a quarterly coaching plan, it helps them for planning, it helps them for organization, and it also helps them to track and implement coaching activities in the state. Some states do not have those monthly and quarterly plans. So what we did was that we took it further and scaled up the monthly and quarterly coaching plan to other states to also guide their coaching interventions. And what we're saying is that it's helping them to streamline their coaching interventions. They're now targeting coaching approaches against some key interventions that already happen within the quarter, like the family planning supportive supervision, like also the RAISE that I mentioned, which is a self-reliance assessment. So the gaps that they see from this FPSS and the RAISE, they target and they implement coaching and they use coaching to close those gaps. So that is also happening. If you look at the next one, that is looking at disaggregating coaching into scheduled, on-demand, and ad hoc, so that it's sort of structured, that makes reporting really easy. What we thought about during the reflection was that we needed to have a coaching logbook so that we could capture these relevant parameters of coaching, and then that makes reporting and decision making for us very seamless. So eventually what we did was that we really developed that coaching logbook, and then we rolled it out across supported states. And easily we can tell you from our hub now that, oh, in a particular month of June, a total number of persons were coached on an ad hoc basis, total number of coaching were scheduled, and X number of coaching were really on demand. So really it has helped us to also be able to capture the relevant indicators that we want to report for coaching. And this is how really pause and reflect has helped us to move forward and improve part of what we do in the TCI Nigeria program. Next slide, Lisa. All right, so pause and reflect exercises in Nigeria didn't come without its own challenges, and most of these challenges were recorded in the beginning when we started to roll it out, and with time, we're able to implement the corrective actions. And I can say that these issues, we don't really experience any of these issues anymore. The first was competing priorities of TCI staff. And then that makes them unavailable for the meetings most of the time. And what we did was that we now integrated pause and reflect into our systems or the existing deliverables that we need to report on. And so every quarterly report that is coming from the states come with the P&R that they've done for that quarter. So early in the quarter, the team would have sat together and identify the topic that is important for them, and they reflect on it, and they share that 1-pager or 2-pager report of that exercise along their quarterly report. So it's seamless for us now. Staff travel and also geographic dispersion affecting availability of the team. Of course, a P&R is even happening mostly virtually, especially for state team. And when we have to come together, we can sit physically, but it happens, and then the state team joins virtually. So that is also happening and very seamless as well. Difficulty in selecting reflection areas was something that we had to contend with in the beginning. So it was easy when we identified ways of selecting topics. Looking at the emerging themes, what is coming up recurrently for us? What are the issues that people are complaining about? What are the challenges? There was a time people were complaining a lot about the RAISE tool, the self-reliance assessment tool. Oh, it is too bulky. Oh, it is this, it is that. So we need to sit and have a pause and reflect on RAISE itself. So it's easier to choose topics when you look at the context of the state, and also you look at the time period where you are holding that pause and reflect. And we now even have a schedule of topics that we just can pick from and reflect on. And initial reluctance from staff as well was one of the challenges that we had because of fears of management appraisal. But when you use an experienced facilitator to lead the pause and reflect exercises, it's easier for that person to address participants' concerns, to create the environment for openness and lack of judgment, and as such, get participants to engage actively in sharing their insight and also supporting the development of solutions to the problems that we're seeing. And of course, management also participates in this P&R exercises sometimes, and they also emphasize the importance of discussing failures to ultimately get us to achieve improvements. Next slide, Lisa. All right, I think this is my last slide. So this is just to share some tips for how we have been able to implement pause and reflect exercises in Nigeria successfully. I think one or two may have been shared by peers, but to emphasize the importance of prioritization of pause and reflect exercises by the leadership. Because if the leadership has not seen pause and reflect as something that is important that would contribute to improving our approaches and the program, then the team members may not be able to also prioritize it or implement it. So this is very important. Also, what we've seen is that if the team members do not have adequate information around pause and reflect and how to conduct it and the importance of P&R, they likely wouldn't be interested in conducting those exercises. So some level of orientation is important in the beginning so that the team also understand it and know how to implement it. When you schedule your P&R and integrate it into existing systems, it's seamless and it's easy than when you plan separate meetings and have it separately or one-off like that. It's not as effective as when you integrate it into your existing systems. Very importantly, you have to include relevant government team members as participants. These are the target persons that are important for P&R. They are the managers and the implementers of the family planning program that we support in Nigeria. So they need to share their insights. They need to brainstorm with us providing technical guidance around some of the solutions that can help them remove the obstacles that they may be seeing in program implementation. We also assign a lead, usually the knowledge management person, to facilitate implementation on a quarterly basis, also to remind staff and to set the reminders for team members to be able to also implement the P&R exercises. And lastly, very importantly, ensuring that the actions from the P&R exercises are implemented and monitored. There's no, it's not good enough for us to just ensure that we hold pause and reflect exercises without implementing the actions or following through to ensure that those actions are implemented for improvements to be seen ultimately. So these are some of the tips that we can also take home as we roll out or as we conduct adaptive management approaches in our different locations. Thank you.
Thank you so much, Laikan. That was hugely helpful. And I'd like to take a moment before we go into our group reflection and discussion to see if there are any questions that members of the COP would like to ask. I think, Simone, you originally said you did have a question.
I do, but I think it's more for group discussion and reflection than it is specifically for Laikan.
Okay, great. Any questions specifically for Laikan?
I don't have a question, and I wonder if other people are thinking this as well, but I just thought it was such a tremendous example of putting P&R into practice, and I really appreciated hearing about the ways in which you kind of even paused and reflect so that you could integrate it within your system. So thank you so much for the presentation.
Thanks, Tara.
Thank you.
Okay, well, lots of kudos, Laikan, especially the focus on the ACT and making sure to monitor what the discussions kind of come up with in terms of actions, and that there have been challenges in integrating it, but what your solutions have been as well. So I guess now that leads us to our group reflection and discussion. And so some of the questions we brainstormed for this part of the meeting was really thinking about what tools and techniques have you all used for adaptive management? What seems to have worked well? What are the challenges? And what would you like to learn more about related to adaptive management? So, you know, we know that a number of you in your projects are also implementing pause and reflect, and it would be interesting to know like how closely TCI Nigeria's experience relates to yours, or how different they might be. So just some of the questions that we've put out there that we'd love to hear your thoughts. And Simone, if you have another reflection question you'd like to add to this, please feel free to share.
My question actually slots right into what tools, techniques have you used? And it's that I think people are using pause and reflect to mean a number of different things. What it reminds me of is when there was a very specific web development technology called Agile, which was a really specific, like step-by-step, many requirements kind of methodology. And then people heard that piece of jargon so often and they loved it, and they started using it as kind of agile with a lowercase a, and it stopped really carrying the meaning that it was supposed to have. So I'm feeling like pause and reflect might be heading in that direction, in that, for example, CCP does every other week pause and reflect on everyone's calendar, but we're not really doing it in this systematized, these are the steps that we're trying to do, and we don't really extract particular actions from it. So I'm wondering if there's like, is there an authoritative methodology that is called pause and reflect that everybody is using the same like framework or steps? And if so, is that, on the CLA web, what is it, the Learning Lab website or something like that? Is there an authoritative one that we should all go look at, I guess?
So CLA does have guidance on pause and reflect, and TCI, the global approach that we put together, which is on TCI University's global toolkit, does come from that guidance, where it is more group-based learning. But as you could tell from, I thought Lacan's slide on, let's see, oh, I went too far, sorry. The reflection on what works why and what doesn't work why. So it's still like an after action review of sorts, but it doesn't have to be like after an event, like where it's more at a larger strategy level. And so I think that's what makes it unique, but often some of the other techniques that are very common and popular within CAM are kind of interwoven, I would say, within pause and reflect. But I think CCP's use of pause and reflect as kind of a no meetings, like deep think day is different from what at least the guidance has been on pause and reflect to date, as well as what, and Lacan might be able to talk about this more, the Curve initiative. They have done a lot around responsive feedback, and it is more group-based learning than it is necessarily like individual learning, so that you can get at that act part.
Okay.
But that's my take. I don't know, Lacan or Bolade, would you like to add more to that?
Lisa, I think you explained it very correctly. Just to maybe say that in addition to that, even though it's mostly like a focus group discussion kind of approach that we use, there's been times where we sort of have what it looks like an after action review, like when we had a big event, like for instance, when we graduated 5 of our local governments or state governments from the TCI program after a 4-year partnership, and wanted to see what really went well with our partnership with them, what the issues were in terms of meeting our goal. Were they able to release funds as we expected? Were they able to take on that leadership to sustaining the program beyond period of, so we had those questions articulated, and then we looked at it like an after action review of the graduation of the states that have graduated, and that helped us to prepare for the next set of graduation. So the graduation that we had 2 months ago, which was after the first set that happened sometimes June last year, was from a learning from the first set of states that graduated. So that looked like an after action review. So say the mix of approaches, really, just to add that bit. Thank you.
Thanks so much. And Lisa, I'm not sure. Yeah, I wonder if you weren't meaning to share your screen there, but I see you were going to grab those links to some specific resources. So thanks so much. This is perfect.
Yeah, so I'll put it in the chat, but so we specifically referenced, oh, I don't know if I'm showing the right screen. Am I? Can you see the pause and reflect and then act?
Yes.
Okay, great.
Yes,
Sorry. So, and what we did was we actually said you can use different types of methodology to help facilitate this quarterly pause and reflect. And what Lacan is getting at, like sometimes it's a focus group discussion, and we suggested like some types of like probing questions that were broad in nature, following the most significant change technique. We shared guidance around after action reviews. If you wanted to specifically do like a data review and how to kind of engage others, especially programmatic staff, on like looking at what the data means from their perspective. The idea of a failure panel. We even considered like learning exchange visits and tours, and then peer assist. And across the TCI initiative, I would say the first two are the most commonly used methodologies that the various regional hubs use. However, that said, there's often data used to support some of the reasons, or why, if you will, behind some of what worked and what didn't kind of discussions. I believe, and I could be wrong, but I'm only aware of one hub necessarily using kind of the fail-fair technique. And there was no report out of it in terms of that was shared. So it was definitely done in person, and I'm not sure, like, and it was a regional hub, so there was that's done across 3 different countries. And so I think the countries had found it very valuable to learn about the failures of each other, but I think they kind of still wanted to keep that somewhat of a closed discussion amongst those. And then there was a learning exchange visit where colleagues from the East Africa Uganda team specifically visited Nigeria to learn more about one of its homegrown proven approach interventions, the 72-hour clinic makeover. And then peer assist, we also do kind of these kind of knowledge sharing at the global level, where we try to facilitate the hub discussions around kind of a key topic, so that we recognize each geographic context is different. And so how to operationalize coaching looks different in India than it does necessarily in Nigeria. Operationalizing the idea of, we're a demand-driven model. And so how do you get local governments to commit resources to the interventions? You know, the sophistication of the health system and governance structures are different within countries, as well as definitely across different countries. So, but those are intentional, but not as frequent, especially as TCI has grown to now be, it started with the 4 hubs and now we're into 6. So also facilitating, especially virtually, some of these kind of learning conversations. It's a lot of time online. And I think the Zoom fatigue is real. So I think we're also trying to figure out how to share without also people being exhausted from it. So.
Great, thank you so much.
Any other comments or thoughts on what people are using particularly well in this area?
I can jump in and talk a little bit about an activity we've done on knowledge success that is a reflection activity. And I can't remember what the 3 stages are, but we've done them as a group where we've kind of picked out either a similar type of approach or activity or a singular activity. And then as part of a team meeting, we've broken into groups and kind of looked at what worked well, what didn't work well, what we would change, and then reflected on that together. I think one of the things that we realized that we needed to adapt in our approach is that as we were trying to do it as a full team, we didn't always have the right people who had knowledge of the activity commenting on it in terms of that, what worked well and what didn't work well. So it was harder for people who hadn't been actively involved. And so we adapt for that reason.
Thanks, Tara. That's a really good point. And that also makes me want to share one other slide. So some of this reflection is probably more comfortable for maybe people that are more qualitative in nature, and some of our more quantitative colleagues might find it a little bit uncomfortable. And so I had facilitated a pause and reflect at a recent staff retreat that I was going to share how we talked about it to kind of to help that audience. So in case this is a useful kind of model, I will share it. So we did a looking back exercise and a looking back exercise kind of at an individual level, as well as like at a project level. But the point is like we defined our terms around what we meant by lessons learned as insights. And then like the why we talk about lessons learned to kind of give more credence, I think. But then we show this lessons learned model so that for my quantitative M&E colleagues, they were able to kind of understand the components that made up the lessons learned and put it in like an equation format that they felt comfortable with. And it seemed to, at least with who I was trying to advocate to, it seemed to work nicely. And I borrowed this, I think, from some work that Japigo has done. So just as an FYI. If this resonates with anybody. And then I think we only have like a minute or two left. So we wanted to thank our guests, speakers, so much for their time, and for you all, our participants. Like I said, if you do have any questions, LACON is, one of our own, and so available on the Hive and elsewhere. And then Pierce was previously a CC peer, so we have ready access to him. So if anyone has any questions, please share, and we'd be happy to relate those. In the meantime, be on the lookout. On the Hive, we'll post this presentation and the recording, and then we're starting to plan our next CAM COP meeting for August, and it will be reviewing some of the updated CAM training package and some key CAM techniques. So please let us know if there's anything you need from us or interested in the meantime, but we'd like to thank you so much for your time.
Thank you so much. This is really great.
Thank you, everyone.
Thanks, everybody. Take care. Have a good day.
Thank you. Have a good day.